Good afternoon. I'm Dr. LAIQ Raja, interventional cardiologist practicing in El Paso, Texas. And I'm accompanied by LORENA Anderson. She's a nurse practitioner and also a navigator for CLI program PULSE. She is part of the team at El Paso PULSE program, and also Dr. Christopher BROMLEY, who is a podiatrist, and he practices in New York. So today we're going to talk about building an amputation prevention program using teams and technology. Looking at the peripheral vascular disease as a general, some of the statistics are that about 12 million people in this country, they are suffering from this disease, and out of that, about 1 million, they have a critical limb ischemia where they can lose their limb. Unfortunately, about 150,000 amputations are done every year in this country, and out of that, more than half of them never even had any basic workup. Very alarming statistics, because the mortality of the patients with CLI is about 60% in 3 years. So what is the real issue here? Why is it so difficult to handle this disease? I want to talk a little bit about different obstacles we have when we are talking about CLI and awareness. We have a very limited communication, and I get blamed for that too, because as a physicians, we are so busy that we just do not have time to communicate with our other colleagues who are involved in taking care of these patients. So there is lack of continuity per se. And another part of this, particularly CLI, is that there is no standardization. It's not like coronary disease where no matter wherever you go, you're gonna get an angiogram and a PCI and stent. Unfortunately, still in this country and all over the world, it's just the luck of draw where you end up coming and who do you see. You may get the best care or you may get the worst care. And on top of that, we have a lack of clinical data. We don't have extensive data proving that what we are doing, how much is it effective in the long run. And then follow-up is also very difficult, patients follow. So these are all different things which leads to the issues we deal with patients with peripheral vascular disease. To overcome this, we came up with a solution of a multidisciplinary approach. What does that really mean? That looking at different disease conditions, I think peripheral vascular disease is one of the condition where one person cannot treat the patient all the way, because there are many things involved. So if someone wants to have a good outcome, meaning amputation prevention, to prevent the amputation, we need to have a big team of physicians and all the other persons working together. So this is called CLI, Critical Limb Ischemia Program. In El Paso, Texas, we have developed a very robust, well-run amputation prevention program called PULSE Amputation Prevention Center. My colleague Lori is going to get into a little bit more in detail that how it really works. But I like to say that anybody who is interested or who is doing a CLI program needs to have a team, including podiatrists, vascular specialists, infectious disease, and it keeps on and on. So having said that, Lori, can you please tell us about how this circle of care works? Because she's a navigator. She's like a person who makes all the connecting together.
Well, I think that our program has been successful because we were able to put together a team of physicians that are passionate, that work together, but also this process, very much like your valve programs or your heart failure programs or your cancer programs, where you have a navigator that is following the patient and making sure that they are getting to all the all the parts of this circle of care so the continuity is intact. In our program, when a patient comes in from any of the aspects of the circle, be it through the emergency room or through one of the physicians, maybe primary care or vascular, podiatry, even the wound care center, whichever entry point they get to, the navigator is activated and starts to help that particular physician navigate that patient through the other levels of care, because these patients are complex. So it's not just a wound you have, usually an infection, there's generally a vascular problem. So how do we get these patients to the right physicians in a very expeditious fashion where we have urgency to get them there? So we need to get them seen sometimes within 24, 48 hours. So that's been the key to our program is accessibility, a strong navigation program where the patient is brought into the program, the navigator is contacted, and the patient is then moved to the most urgent physician. So if it's a vascular issue, we triage that patient and we get them over to the vascular physician, sometimes within the same day. If they have an infected wound, we get them over to wound care immediately and address that with maybe a dose of antibiotics and bridging them to infectious disease. We had put a plan in place for this patient with a strongly coordinated team. That being said, this program is excellent, but it also has its limitations because you have a physical person trying to navigate this patient or a team of navigators. So it becomes very labor intensive. A physician has to reach out to the navigator has to call and make the appointment. You have to follow up with the patient and make sure that they follow and get their diagnostics, get them back to the physician, get them over to infectious disease. It becomes very labor intensive, and so there's sometimes communication lag time. By the same token, after a procedure is done, for example, a revascularization, that podiatrist may want to know what was done, was the procedure successful? They have to text the navigator, who then has to look up the procedure. And so the communication is there. It's just there's some labor-intensive features to it. We've made great strides because in most programs there's not a strong communication. So we have a really great follow-up, really great follow-through for the patient. But I think there's still some challenges that I think we found that we needed help with.
So it seems like that we are making strides. We know that treating this disease needs a team of physicians and team of persons from all specialties, and we have shown in our practice that it really helps, and we have one of the lowest amputation rates in the city. But again, now the issue is there's so much wasting of time. I know that half of the day you are on the phone, just calling other physicians and other persons who are. So I think we need to have another step forward, okay?
Right.
And this is one of the reasons that we are here. I would like you to tell us more about we heard and we are part of that, a new technology which we are trying in our practice. How does it work, and what do you think, what's the future of that?
That's great, and very well said, and you're very blessed to have someone as talented as Lori to be that superwoman navigator that she is. I mean, I'm impressed everything that I've heard today. We're here to talk a little bit from my perspective about how we changed our practice. I'm in New York. We have a 70-physician multi-specialty, many podiatrists, and we were having the same troubles navigating patients. We didn't have someone like Lori, so there was a lot of wasted time, a lot of miscommunication. And I discovered CarePICS last year, which is an app. It has 4 pieces to it. So on the screen, you'll see that there's a report function. In our practice for many years, when we would document wounds, we did what everybody did, where we would take a picture and we would have a ruler, and hopefully those pictures and hopefully those measurements ended up in the chart. And we all would admit that it eventually, hopefully did. But the advantage of using CarePICS is it allows me to take an image of the wound, measure very simple on the picture, and then I can move that measurement and that image right into the chart. And more importantly, if I need to consult my colleagues like yourself, I don't have to get up out of my chair, write a prescription, give it to somebody like Lori, have her then get it to you. Maybe the patient would get there. So then what we do after we've done the report, we use the consult piece. So with the tap of my thumb, we use CarePICS to send that patient directly to you. HIPAA compliant way, no wasted time, instant referral. As soon as you and your team gets that, you can consult me back that I know that you got it. When you've taken care of the patient, then as part of the reporting process, you can send me back the images of what you did. So everybody is together working on the same image, the same measurements, the same patient. So CarePICS is really that connective tissue that we work together, that makes our jobs easier and makes the level of care much better, and we're going to get those outcomes and prevent amputations, which is why we're here. There's two other pieces. One is, one of the things that came out of COVID was that the need for telehealth became very apparent because we weren't able to get patients in. We were closed down in New York for quite a long time. So there is a virtual health piece of CarePICS that allows you, no matter where you are, it could be a Saturday or a Sunday or an evening, you can always use CarePICS to do that consultation with a family member or the patient. Patient can use the app to send us pictures so the patients can report how the wound is doing when they're unable to get in. And the last piece is the order piece. So every patient that we're treating for wounds needs some sort of dressing, whether it's wet, dry, needs a biologic. We can use the order piece to basically, with the tap of my thumb, order whatever I need. It gets shipped to the patient. So those four pieces. The reporting piece makes my job easier because I don't have to remember the measurements. I don't have to look for the pictures. It automatically gets imported into my EMR. I can then coordinate care using consult, which makes the patient level of care better. You and I can communicate the old way. We had pictures on our phone, right?
Right.
And mixed in with our kids and the pets.
That's right.
And we had text messages back and forth, which we know now because of the rules of HIPAA are not the best thing to have on our phone. So the advantage of CarePICS is everything's encrypted. We don't have to have pictures mixed in with our family. Everything is stored on the web, so there's no risk from a HIPAA compliance perspective, and it coordinates our care with each other quicker. We can communicate back and forth. The patients love it. When I have a patient download CarePICS, when they're in the room, first visit, I explain to them, you have now 24 hours, 7-day-a-week concierge wound care. And the patients are blown away. They're like, what? I'm like, yeah, you can communicate with me anytime you need to, and we can communicate. The patient can send me images. I'm not giving my cell phone out anymore. Patients can communicate with me in a safe way. So that's how we use CarePICS, those four features. This is what it looks like. So if you look at the images, you'll see here one of my patients. This is a diabetic with a Charcot. They've got a breakdown. You see a little green dot. For those of you that don't know CarePICS, when we take a picture, the green dot is the reference. It measures 1.9 centimeters, and the calculation of the wound measurement is done automatically off of this photograph. So we take a picture, circle the wound with our finger. That creates the measurements you'll see on the right side where it says chart. And then, in addition to these measurements, which have revolutionized the way that I document, we can also track the wound. We know that wounds get better. Sometimes they get worse. What we're doing with CarePICS is we're trending the wound, and you can see on the bottom right the trend of how this wound is doing. And this represents what a typical diabetic will go through. They'll get better, they'll get worse, they'll get better, they'll get worse. But what we're trying to do with CarePICS is elevate the level of care. So when you see something like this, when you see a wound not getting better or a wound getting worse with that big spike, we can then use the consult feature to communicate with each other.
Right.
On the first visit, I should have been sending the patient to you for evaluation.
Right.
Maybe you did a revascularization, you send me the images back, but if I see a spike like this is a warning sign. It's very, very easy to see. This is a patient where I send this patient back to you and say, hey, Dr. Raja, what do you think about this? This is what the wound looked like. You can see all the pictures. You and I are looking at all the same images. We're looking at these trends, and someone like Lori can help facilitate that, but that's a patient we need to have another look at. So
another thing is that you can have a little objectively, you can see that comparing the wound, is it better or worse? In my practice, one of the issues is that once we know a podiatrist or wound care physician thinks the wound is not better, by the time I see them, and arrange for revascularization, it might be a week or maybe longer because the communication didn't happen.
Right.
I think this is, this should have been done a long time ago.
Yeah.
Why didn't anybody think of that? But I'm glad somebody did.
Yeah.
You guys did.
Yeah.
So it definitely helps to get the care to the patient as quickly as possible.
Right, it's that connective tissue between
Right.
you and I, and our teams are now connected. We're in different offices.
Right.
We can be in different parts of the state,
Right.
but because we're all looking at the same images and the same objective data, we can make good judgment and good decisions about how we want to manage this patient, and we can work together as a team. And that's what's going to give us the outcomes and save lives and save limbs.
Right. And it's helped with all the specialties, because I know that since we started implementing it, even within our vascular team, we have people in the hospital rounding, people in the office, people in the wound care, because we have all these different components to our program. Now we're all looking at the same images. We talk on the phone, we pull up CarePICS, we know that they took a photo in the hospital, and now we took a follow-up in the office. And so from the vascular side, I think that many vascular practices don't necessarily have this component where you're able to capture the wounds, and then you collaborate with your podiatry team. So in our program, we have a wound care center, Amputation Prevention Center. We have the infectious disease office, we have the vascular office, so we can all look at the same group of pictures and collaborate on the same images. And so it's tracked from different disciplines as well, not just the wound perspectives, which is really important.
And it's obviously this app is still in process, so we are also adding a vascular part to it.
Yeah. If you look at this report, this is how we can communicate with each other. So what we typically do in the podiatry part of our practice is I like to send reports to the primary care doctors, because I want to make sure that everybody's included in the team, and we have infectious disease specialists. So this is an example of what for this John Doe patient, here you see a great picture of their wound, and you see a picture of what our vascular interventionalists have done. So this is how we communicate and raise that level of care. And I think that this is the future of medicine, is to be able to communicate back. And one of the new versions of CarePICS is you're going to be able to upload everything that you did. Right. Those images. You don't have to send me a text message like you do to your colleagues. It's all going to be built right into the app. So it's made my life easier. The patients have a much better level of confidence that we're all on the same page, and we're going to see better outcomes. This will be the standard of care moving forward.
So this is what we are talking about in the future. This is going to be another additional part of this app, is that pre and post images. It's very important for a podiatrist or any physician who is part of that to see what exactly was it done. Let's say if the part is the toe, they can see what is happening to the anterior tibial artery, which artery was revascularized, and going all the way down to the foot and the toe, how much flow has improved pre and post, right? As we said, the images are better than 100 words, right? Just showing them a couple of images pre and post to the target part of the foot will make huge difference. And obviously, as a follow-up in the future, if something is not going right, we take another picture and see, well, is there restenosis, is there reocclusion, so we can follow that at the same time.
And you can compare those pictures, because you'll have them by date.
Right.
And then in addition, there's going to be a notes section where you can dictate or add some comments about what artery was intervened on, maybe what the plan is. We're going to bring them back in 3 weeks to do the other leg. A clearance for surgery. So instead of waiting for the report or the text back that everything's okay, when you're seeing your patient, you can just open up your CarePICS and say, okay, looks like you're clear for surgery, we can move forward. So those are, I think, aspects that we found were necessary to integrate not only the podiatry side but the vascular side, and really kind of close that circle and make that continuity really work. Makes my job easier, because my phone calls have decreased because we're operating on more of a real-time platform, and we can communicate better.
How about, tell us about a little bit about reimbursement part.
That's a great comment. So one of the things that came out of, one of the only positive things that came out of COVID was the COVID Preparedness Act. CMS raised the level of reimbursement for telehealth and raised the level of reimbursement for any of the virtual, when you send an image, if I sent you an image of a wound, or I send you a consult, or you send me a consult back, the level of reimbursement for those items went up. And those items, according to CMS, are here to stay. So when you're using and practicing good medicine with this tool, you get rewarded for that. And those are codes that you can bill for. One of the things I love as the administrator of the practice is I don't have to worry about that. Every month we get a report back from CarePICS that lists all the interactions that happen through CarePICS, so that the administrators in my practice that do the billing can track that and make sure that we're getting paid for doing best medicine. And I think that one of the things we talked about at the top of this presentation is there's no standards there. So what you're doing at PULSE should be the standard of care. What we're doing in podiatry, using CarePICS to create these relationships, should be the standard of care. What we're looking to do is establish protocols like they did on the thoracic side, cardiovascular side. We want to do that in the lower extremity. So what you're doing and what I'm doing can be standardized around the country, and we can put CarePICS and the PULSE program in the hands of excellent doctors around the country to get those great outcomes.
And I think working together, that synergy, we are going to be able to make this available to physicians who want to create a program. We're definitely available to help other physicians, and we'll have our information available if there's someone who needs our assistance to guide them. I know CarePICS has a strong team as well for implementing this program for physicians, and so I think that it's important to bring that synergy of a strong CLI program, strong amputation prevention program, but with this piece it makes it very functional, very collaborative, and it really keeps that continuity going. So I think that the future is really bright. And it's funny, Dr. Raja says there's really no standards, no guidelines. I think that what we're doing here is, some people, Dr. Raja has stated this before, some people are going to follow the guidelines. I think we're going to be the people who are creating those guidelines and who are bringing everything forward for treatment of CLI and for better outcomes.
I think this is a great progress in this field, and I mean, I've been doing it for years, and I can really see how it's changing and how it is progressing.
Right.
And I think that CarePICS has come right at the right time when we are improving our clinical care and making team, and now we just needed, as you said, connective tissue to connect us together.
Right.
And I'm sure this app will continue to improve, and we will keep adding more things as we learn what are the other needs the physicians and other people who are a part of this team they need. What are your thoughts in the future? The
future is very bright.
Yeah.
I think that we're working with physicians around the country to roll out CarePICS and put it in their hands and make their lives easier. We're partnering, we're putting podiatrists together with great endovascular and vascular specialists. So we're hoping to raise the level of care and put CarePICS in the hands of physicians, but also we're looking to improve care in the SNF environment and home health, where there's a desperate need because folks like you and I aren't going to get to those facilities. So we can put CarePICS in those different places and get more patients this level of care so that we can save more legs and save more lives.
Absolutely.
Well, thank you so much. I think it was a great discussion, and I have no doubt that this new technology is going to be very, very helpful for all of us, and particularly taking care of the patients and have a better patient care.
Great. Awesome.
Thank you very
Thank
much.
you.
You're welcome.